morning. Hello, everyone. I am Dr. Anand Jha. I am Senior Consultant Medicine in Max Hospital, Salimabad, Delhi. First of all, I hope you all are doing fine in the times of this COVID crisis. As you know, COVID-19 is a new disease with a lot of misconceptions, and we are having a plethora of information from the media, WhatsApp, Facebook, everywhere. So we are very much confused. So I think you all will be confused. Well, one thing is there that diabetics, they have got a slightly more chances of getting this infection, having more complications. There's nothing to be worried. Stay calm, stay positive, and I will tell you a few tips which is going to help you in overcoming this virus if at all it happens, or to avoid this infection COVID-19. It is true that in diabetics or other comorbid conditions like heart disease, kidney disease, bronchial asthma, chronic bronchitis, patient taking immunocompromised medicines, cancer patients, or patients with more than 65 years age are more prone, and they have got a severe type of COVID-19 disease. There's nothing to be worried about it. Today's my brief is that I should speak about the diabetes and the COVID, how to avoid it, and how to control the blood sugar during this epidemic. First of all, as all you know, you should always take medicines, whatever prescribed by the doctor, and regular blood sugar monitoring should be there. If the sugar is not controlled, you can always talk to your doctor by telephonic consultation, or the video consultation, or the WhatsApp, or any form of communication, telecommunication. You can consult him and keep your sugar under control. Your sugar fasting should be around 110 milligram percent, and postprandial should be about 150 milligram percent. That should be your goal. Second thing is, which is very important because we're all indoors with very little exercises, which is, and walking, everything is almost stopped because parks and these things also closed. So what are the measures you can take? One is the lifestyle modifications. As we all know, this is regular exercise. Though we can do walking or these things, but we can do about 30 minutes exercise, which may include stretching exercise at home, maybe yoga, maybe pranayam, maybe meditation. These things you can do for about 30 minutes. That will suffice the goal. Second thing is about the diet. We should have a regular meal in the fixed timings. We should avoid high calorie diets, high sugar diets, high carbohydrate diets, high fat diets. This we should avoid. We should take a lot of leafy vegetables, salads like cucumbers, kakadi, onions, radish. This thing you should use in the plenty. Second, you should have a lot of fruits like orange, apple. We have the season of this watermelon. These things you can have in plenty. So these things, a lot of water one should always take. Salt restricted diet should be there. We should not have very high salt diets. So these things should be taken very frequently. You should avoid junk foods, aerated soft drinks, and very frequent heavy meals that should be avoided. If you want to have meal snacks, kind of small like chana or these things you can have, or maybe fruits, you can have just small thing weights. So these are the diet exercise. Secondly, you should have a good natural sleep. So natural sleep, because we are not having a lot of activities, so sleep is a problem. So what should do before sleep, at least half an hour, we should avoid watching TV, mobiles, laptops, or any other electronic item which produces blue screen. You should avoid for half an hour, then you can go for sleep. Second is, you have a lot of activities, indoor activities like gardening, by cooking, having some crafts made, so that you can have a good family time and you spend your time also, and your mind is very healthy and sharp. So that is very, very important. And finally, I can tell you, we should be positive. We should not be scared of anything. And whatever the government's recommendations are there, and advice of the medical professionals, like frequent hand washing, use of mask, use of personal hygiene, the use of gloves, and of course, most important, social distancing. This should also follow these things. So, Indian, I can tell you, you stay positive with all the precautions we take. Have a good sugar control, good BP control because you have got BP, and keep your mind in very jolly mood and very relaxed. That's very, very important. So, to conclude, stay safe, stay indoors, stay healthy. I think that is the message I want to give. Thank you.